Welcome to Healthcare Workforce Unplugged, a medical solutions podcast. If you're a nurse executive or a healthcare leader trying to figure out how to build or maybe even rebuild your clinical leadership teams right now, you are definitely not alone. Today, we are talking about something that's becoming a really important part of that conversation: how international direct hire recruitment can help hospitals and health systems strengthen their teams, not just today, but for the long term. I'm your host, Kristen Dahl, and joining me is Laura Messineo, Chief Nursing Officer at WorldWide HealthStaff Solutions, a medical solutions company. Laura has been a nurse leader for decades, and now she's helping organizations across the country stabilize their workforce and grow leadership capacity through international direct hire recruitment. Laura, it's such a pleasure to have you here.
Thank you, Kristen. I'm thrilled to be here.
You've had such a fascinating career path, from clinical operations to digital innovation and now international direct hire recruitment. I'm curious, with all of those experiences, how has that shaped the way you think about building strong, resilient teams?
Well, I think that's really a great question. Having worked across so many different clinical areas, it really highlights the fact of how much everything connects together, from patients' outcomes to team culture, and also to leadership opportunities. It all kind of rises and falls together. My experience has really taught me about resilience. It's not just one individual trait, it's a whole host of different traits put together, and really building through systems that consistently bring people over time.
Absolutely. I think a lot of leaders can relate to that feeling, wanting to focus on leadership development, but constantly being pulled back into staffing challenges. From your perspective, what's really driving the ongoing shortage we're seeing? And how does that trickle down into leadership development for nurses?
That's really such an important question. The workforce challenge, in short, is multifaceted. We've got many different things that are happening all at the same time. We've got retirements that are occurring. We have some nursing burnouts that occur. We also have a very large amount of new grad nurses that lack experience in the space. But we also have a growing problem across the US related to not enough of nursing schools. And that's really a result of not having enough nursing faculty in order to stand up those nursing programs. It's really overlooked on how to close the loop on the staffing gap. In the international direct hire space is one way that we can close the loop in that space by bringing seasoned nurses that have 8 to 15 years of experience over to the United States in order to help support a long-term strategy of staffing. And that really creates a pipeline for bringing seasoned nurses over, which is also going to directly help with leadership opportunities, bringing nurses that have former experience in leadership in a different country and bringing them to the US. And as they're assimilating to US-based practice, there are many different opportunities for them to advance their career in leadership.
Yeah, absolutely. And I've heard people describe it as you're not replacing your current team, but what you're really doing is supporting them so that they can really take the time to focus on learning and growing. And then, of course, on that excellent patient care. So I think many leaders are familiar with international staffing in general, but maybe not the direct hire approach. Can you break that down a bit for our audience and also explain how is direct hire different from what we might think of as traditional contract staffing?
Sure. So, absolutely. At Worldwide, we specialize exclusively in international direct hire. So, what is that really? It is, we have 17 different countries that we recruit nurses from. We contract with US based hospital systems in order to understand what their clinical needs are, areas where they're having challenges in staffing. And with that, we decide collaboratively what positions they'd like to recruit for. We then go through a very structured process that we post a position. We have an international nurse that applies for that position. We evaluate their competency, and then we place them for an interview with that hospital system. That hospital system interviews that nurse like any other domestic nurse they would. They would determine if they're a good fit. They would then give them an offer. And then the international nurse really has a decision to make. Are they going to accept that offer at that facility and that geographic location? And then once that occurs, we take the nurse through the immigration process. These nurses do receive an EB-3 visa, and it takes us about 18 to 24 months for the nurse to actually come over to the United States. But during that time, we are helping to support them from a clinical perspective and also from a legal perspective, ensuring that they obtain their visa. Those are just some high level overview of our program. And then on day one, when they come over to the United States, they are the health systems employee. They are paid at fair market value. They receive the same benefits and pay as any other nurse that would be working at that facility.
Can you also maybe share an example of a health system that's seen measurable impact after implementing a direct hire model?
Sure. We have many cases of that. We have a very specific case out in Iowa. We've been working with them for over 5 years, and we learned through working with the chief nursing officer there that their current vacancy rate for nursing is at 5%, which is 11% less than the national rate. And in addition to that, we also found out that they have an international 95% retention rate for all of their international nurses that WorldWide HealthStaff has brought them. They really feel as though the international nurses have been a great addition to their team. And they have many different cases where these nurses have also been promoted to leaders in the organization.
That's a very important point, and also leads to my next question. So, how does this direct hire model help leaders actually build the leadership bench that we hear so much about?
Sure, that's really important in today's healthcare environment. These nurses are nurses that have many years of experience in other countries, and quite frequently they also have leadership experience. Many of them are charge nurses. They could be managers, directors, and really it's their lifelong dream to come to the United States. And with that, they accept a staff nurse position. That allows them to learn about US based nursing care and allows them to take their previous knowledge and excel. And then they are also awarded some of those opportunities to advance their career and be put into leadership positions.
Switching gears a little bit here, the integration piece seems key, especially with culture and patient experience. When an international nurse starts at an organization in the US, how does Worldwide support both the nurse and the organization in order to make that transition successful?
We partner very closely with our clients. We also have offices in the US, in the Middle East, in the Philippines. We understand really the journey on both sides. Our focus is not just on recruiting nurses, but on the transition to practice and also clinical integration. We help to ensure that these nurses can be successful at their new organization and that their new organization are ready for them. And really, we support the nurse through a turnkey approach from pre arrival preparation and credentialing to onboarding and long term retention support. We also work very directly with all of our hospital clients. We are true partners to them, listening to what the opportunities are and the gaps are, and how we can partner further together in order to support both the organization and also the nurse be successful when they are actually onboarding.
So, you've touched on culture, stability, and leadership growth, all of which really connect back to purpose driven nurse leadership. For leaders who may be exploring this model for the first time, what are some of the first steps or key considerations when integrating international direct hire nursing into their staffing strategy?
It really starts with leadership alignment and setting clear expectations. Organizations that are really successful in this space view international nurses as a long-term workforce strategy. This isn't a short-term solution. This is about building a pipeline, and that is an ongoing pipeline in order to address the severe nursing shortage. It also is really important to engage your nurse leaders from the beginning, helping them to understand what the international direct hire process is, openly being able to answer their questions so that they fully understand that an international direct hire model is these nurses are part of their nursing team, and that building out the ability to assimilate into their culture and their community are some of the very important things. In addition to that, it's very important to have a buddy system for the international nurses. It helps them with their transition. They're dealing with many new things all at the same time. Not only are they transitioning from a clinical practice in another country and in adopting all of the US-based standards, but in addition to that, they're learning how to live in the United States in that local community.
So, this model really does seem like a viable long term solution for healthcare facilities. So, I'm curious, what are some of the common misconceptions that you've heard from hospital leaders on why they may be reluctant to use international direct hire as a part of their workforce strategy?
Sure. Sometimes we hear that the international direct hire takes too long. And it really is a longer term strategy. And that's probably one of the key things. There's a lot of different levers when you're looking at stabilizing your nursing workforce. And the international direct hire is just one lever that you're pulling, recognizing that it's a long term strategy. And if you are thoughtful in the process, you blend that very nicely with your contract labor and your US based direct hire. And that really creates a model where you're bringing in very seasoned nurses into your pipeline in over a period of time.
Before we wrap up today, I have one last question for you. For any CNOs or nurse executives who are listening today who are considering international direct hire recruitment, what is the key takeaway you would want them to remember?
I'd really say that think beyond your short term filling vacancies. Think about building your future leadership bench. International direct hire isn't just a staffing solution, it's a strategic investment in workforce stability, diversity, and the next generation of nursing leaders.
Perfect. Very well said. Thank you so much for sharing your insights today and for the important work that you do at Worldwide.
Thank you for having me.
To our listeners, if you're looking to strengthen your clinical team and leadership pipeline, you can learn more about WorldWide HealthStaff Solutions International Direct Hire Solutions at healthstaff.org. To learn more about how that all fits into medical solutions and our offerings, visit medicalsolutions.com. Thank you for joining us on Healthcare Workforce Unplugged. Be sure to subscribe for more conversations with leaders shaping the future of healthcare staffing. We'll see you next time.